Hi friends, this is Dr. Balakumari. In this video, I will talk about white discharge, which is one of the common symptoms many women face. I will explain what constitutes normal white discharge and when it is abnormal and you have to consult the doctor. Watch the video till the end and you will get plenty of information which is very useful. All the openings in the body will secrete a liquid. The purpose of the liquid is to lubricate that place and protect it from infection. For example, when you take eyes, it is tears. Nose, there is a mucus discharge. Mouth, there is saliva. Ears, you have wax. And vagina, you have a secretion. All these openings connect the external world to the inside of our body. These openings are covered by a thin tissue called a mucous membrane. Unlike the skin, which is thick, these mucous membranes are thin. When they dry up, they can get infected very easily. To protect from infection, nature has given this lubrication. Estrogen, a female hormone, is secreted around puberty. This increases the mucus secretion from the vagina. You will be surprised to know a newborn baby, a girl baby, can have a white discharge for a week starting from day 3. This is because of the estrogen secreted in the mother's body. Baby was exposed to it when it was inside the uterus. From that period till about 10 years, till the girl reaches puberty, there is no estrogen in the body. So generally that place remains dry. Some children can get white discharge, which may be like pus and which may be producing burning and irritation. These children, sometimes without their knowledge, they might put some objects inside the vagina, like a pencil bit or a chalk piece or some other instrument. So whenever a girl child complains of white discharge, a little irritation in that place, please take her to your doctor and then get her examined. Then comes the adolescent period, between 10 to 20 years. Around 10 years, the girl gets exposed to estrogen for the first time in her life. The vaginal secretions become more. These vaginal secretions are little excessive on the day of ovulation, which is around 14th day in a girl or a woman who is menstruating regularly. Ovulation day is the fertile period. Increased mucus secretion lubricates the vagina and make it easy for contact and also makes it easy for sperms to travel into the uterus, and it protects against infections. This mucus discharge is acidic in nature. This acidic nature is the reason for the white bleaching that happens in the undergarments of these girls. Between 10 to 20 years, there will be the adolescents experience sexual feelings for the first time in their life, and that may produce a little excessive white discharge. If the white discharge is colorless, mucus-like, there is no itching, burning or bad smell, you really don't have to worry. That is normal. For some girls, it may be slightly more, and some girl, it may not be there. When it comes to a reproductive age group is 15 to 45, but the legal age for marriage is 18. So during this period, there are 3 common infections that can happen to a woman. The first one is called a trichomonas infection, in which the discharge is a little greenish, is frothy, has burning sensation and a little altered smell and sometimes itching. The second commonest infection is called moniliasis or candidiasis. This is a fungal infection. In this condition, the discharge is flaky, like cotton flakes, or how when the spoilt milk, how does it look? So just like that, it will look, and there will be redness in that area, and there will be itching and burning. This fungal infection is more common in diabetic women and obese women. The third infection is called bacterial vaginosis. In this, the discharge is grey in color and has an altered odor. Generally, they will not have itching or burning. The smell will be fishy odor. All these 3 infections have to be treated along with the partner. The wife can transmit the infections to the husband and the husband can transmit to the wife. These infections sometimes may happen again and again. Just like how you get cough and cold, this may also happen on and off. And every time it comes, it has to be treated completely. The husband also has to be treated even if he has no symptoms. There are sexually transmitted infections which can produce severe white discharge, lower abdomen pain and fever. If these symptoms are present, the woman should consult the doctor immediately. In this reproductive age group, if there is what is called a polyp is an extra tissue growth in the cervix or uterus. This can again produce white discharge, sometimes stained with blood. It can produce infection of the uterus and the organs around it. So these people need what is called as a speculum examination and an ultrasound, and if necessary, a pap smear and an endometrial biopsy. Sometimes, if there are collections of infected fluid in the tubes, that also can be the cause for the white discharge. Again, this has to be ruled out by an ultrasound. Coming to the post-menopausal women. See, after menopause, there is no estrogen in the body. When there is no estrogen, the area is dry. If these women develop white discharge, they should go to the doctor immediately. We are more worried about cancer-related problems in this age group. These people can also be having white discharge due to infections. But it is very important to rule out cancer-related problems. It can be cancer of the mouth of the uterus, called cervical cancer, or an endometrial cancer, or even very rarely tubal cancer. So to sum up, white discharge, if it is clear, transparent, mucus-like, there is no associated itching, burning or bad smell, it is normal white discharge, no need for any treatment. But if the white discharge is associated with itching, burning, bad smell, lower abdomen pain and fever, the woman should consult the doctor and get it treated. It's important to check the partner also and treat him. Thank you for watching the video. I hope you liked it. Like, comment, share and subscribe. See you in the next video. Thank you.